This is Sam Robson here today again with Dr. Pierre Rollin. This is June 27th, 2016 in the audio recording studio at CDC's Roybal campus in Atlanta, Georgia. Thank you again, Dr. Rollin, for being here.
Thank you for having me.
Of course. And I think today we'll really just be focusing, last time we kind of did a more or less chronological account of your various experiences with viral hemorrhagic fevers in Africa. And today we'll really be focusing on the 2014 West African Ebola epidemic. Do you remember what you were doing immediately before, getting the word about the epidemic and going to Guinea?
No, I remember when I received a first call saying there is something suspicious going on, and we got a sample, and it was from the Pasteur Institute in Lyon, and then also I got another call from the Médecins Sans Frontières telling me we have something going on in Guinea, and then within 2 days I got an email, or an official email through the WHO, I think, saying there is an outbreak of Ebola in Guinea that was confirmed the 21st of March 2014.
Right. So what happens then?
Then at that time I was acting branch chief because Stuart Nicholl was somewhere, I don't remember where he was. So I decided I will certainly go to this outbreak because it was Guinea and French speaker, and so I tried to round up people that will be able to come with me. And then we had this EpiInfo database that we were trying to put in place, but it was all in English. So we decided to translate that very quickly, all the screen and all the questionnaire, and to have that quickly in French. So we had 10 days to make it in French. And I think even when we arrived, there was still some misspelling and some mistake here and there, but it was more or less in French. And then trying to get all the paperwork for the trip. So EOC was not activated at that time. So we're doing the usual way to go to Africa. So you have to call the embassy or the DCM, try to explain, unless you have a country office, which we didn't have at that time. Try to organize that, try to say, well, I can come, but I need an invitation. We cannot just land it like that in Guinea. We need an invitation of the country. And then at that time, try to remember, I think Ray Arthur was involved. Here, Ray Arthur is making the coordination between CDC and WHO Geneva. So he contacted us, say, oh, there is an outbreak, I think you're aware of it, and we can help if needed. And he organized to have that to have us deploy within the GORN, the Global Outbreak Response Network. So when we arrived the first time, we were first trip.
You said Rialto managed?
Ray Arthur here.
Oh, Ray. Okay, gotcha.
Yeah.
Sorry.
Ray Arthur here. I think we arrived without a visa. We didn't have time to have visa because to get the visa, you have to have the invitation and the ticket, and you cannot have a ticket if you don't have the invitation, and if you don't have a travel order, and then that's all the vicious circle here to get the travel order. So we didn't have time to get a visa, so we arrived without visa, but the embassy told us that they will be able to get us there and take care of that. So we worked mostly with a person that was not the country office, but that was a CDC there for Malaya, the program, Malaya initiative there. So she was the one that did all the help with that.
Right.
So we got a letter saying you will be received by someone at the airport and help you to go through the custom and everything, and that was that. So, but the 10-day was short to get everything ready and the team ready to go. So, in the team selected, there was some French speaker, obviously. So from the branch, we had Ilana Schaefer that was involved in creating the VHF AP Info database. We had a guy that didn't speak a single word of French, and most of the time in Guinea during his trip, he ate pizza and pizza and pizza and pizza and pizza. That was the computer guy that tweaked the software every night. So every morning we had a new version of the software, looking at the bug, at the change that we want to do. Eric. And then we had Craig Manning that was doing the health education and communication. He works in our branch, so we used to do that, and he speaks French. And the last person that came with us was Andrea McCullum from pox virus. We worked with her before. She speaks French, and she was also very useful because of that.
I've heard a bit about how there were initial difficulties in getting into Guinea. I don't know if you experienced any of that with. I heard this in my interview with Dr. Frieden, where he talked about the regional WHO offices asking for paperwork for people from CDC, and Dr. Frieden
so
actually
that,
had to get involved.
That to get through the GORN network, you have to be accepted by Geneva, and you have to have a medical exam, and then there's a lot of paperwork to be done for that. And it's useful to be through the GORN, but it's also not very useful. It's financially it's very rewarding. We have to sign a contract, and we were paid, but we never touch it, in $1 for the trip. And we can have in different installments if we want. So I asked for that, and I asked to have a copy of the contract because I want to frame it with a $1 bill. And that was didn't work that well. But at the end, it's just a paperwork. We still had to wait anyway for the official invitation and everything. So it just had another layer of things, but didn't really delay anything in the trip. And then when we arrived, we chose, or the embassy chose an hotel for us that was very close to the WHO, so we can walk in. And we start to work with WHO. We make our office in WHO and start to work there.
Gotcha. So how do things proceed?
So it works fine. So the main things was to try to collect data. At that time, there was few cases in Conakry. There was a treatment center in Conakry run by MSF. And then there was more cases, much more than we thought, but there were more cases in the Guinea Forestière. So Andrea went to the Guinea Forestière. Ilana worked with the people in Conakry. We tried to go every day to the ETU to collect some clinical information and some form and help to complete the gap. And we met nearly, I think the next day, we met the ambassador that invited us for breakfast, a walking breakfast, at the residence. And then he told us what he knew, and we told what we knew. And he started the cooperation with the embassy, start very quickly at that time. So, and it was Alex Lascaris, the ambassador at that time. It was really fantastic. That the best person I ever met, because he knew everybody, he has his access to everybody, and I think we worked the best. So he provided us the politics, and we provided him the science. So he opened all the door for us. So he organized very quickly a meeting with the Ministry of Health, the President, Alpha Condé, and he's really put himself, say, well, I'm doing the politics, but if you have any question on Ebola, you ask this guy. And he was really set up such a way that we were able to work very easily with everybody, knowing that we were covered, quote unquote, by the ambassador. And then during this trip and the other trip, when we had any question, he said, well, let me know what I can do. And then he organized trip with helicopter to go in one place or the other, with the Grand Imam, with the Bishop, with the Minister of Health, with the coordinator, Sakoba, and everything was really organized by him that way, and he was really fantastic. He organized a meeting at the MSF Center. So MSF had some trouble with the Ministry of Health because it was not very well accepted. I don't know why. They went up and down between the president, Guinea president, and MSF. But he did it. He organized their meeting where you have the Grand Imam, the Bishop, the Minister of Health at the MSF treatment center. We had picture and there was film with the sign MSF on the back, the people from MSF explaining everything. So MSF was easy for me at that time because I knew the leader from the treatment center. I met him before in Uganda and everything, so the connection was very easy with him. And in fact, I realized there was no contact tracing organized or well organized, and the contact tracer were not paid. And I had no fund to do it, but by talking to MSF, they say, well, we have some fund, we can give you money. We don't want to be quoted because we don't want people to come and ask us for money all the time. So I was going there with a duffel bag, and I got cash, and I pay every day the supervisor of the contact tracer and organize that every day. So the VHF system was not, it was starting, so there was only one computer at a time. So there is data that we cannot enter, only one person can enter at a time. So the people from WHO and the Ministry of Health were entering data during the day, and at night we were correcting the data, entering some other data concerning the contact tracing, and so they will be ready for the next morning, and the next morning we give them the new version. It was working. So we used to work a shift during the day with the Ministry of Health and WHO, and the shift at night at the hotel to entering data and to do all of that. There was also another person speaking French with us. I'm blanking on the name.
That's okay.
It will come back in 5 minutes.
We'll put it in the transcript, but what did they do?
Yeah, helping us also for the follow-up of the contact and to collecting the data and organizing the data. So the WHO office was small, but it was completely reorganized to help us to have to enter the data, and they were starting to have meeting. One thing that was obvious is there was no real health communication, neither to the healthcare worker nor to the population, general population. So organized by both the U.S. Embassy and Craig Manning with me, we start to go to the radio and appear in the talk show and making communication. So the ambassador was talking, and then I was talking, and then doing all of that. I also did I offered to the embassy to make a talk for all the expats there to explain what was Ebola, what they have to fear, because they had a lot of questions. So I did that first, and then I did it a second time in French for the worker on the embassy, not U.S. citizen, for the driver, the cleaner, and Craig Manning recorded me at that time with a small digital camera, and then he created a small movie with that, and he was provided to the airport on the TV, on the internal circuit, and it's still going on. It's not very good, because it was really created, not filmed in the right condition and created overnight in a hotel room, but it was there, and it's still going on. We should have changed it, because they cut even the sound, so it's only the picture, and you can read a little bit in French of the presentation on the back, but could have been much better, but nobody did it, and it's still there.
What were you sharing in those
So
segments?
how you get infected, how you protect yourself, what the risk, what the population at risk, what you should do to avoid it, and the person coming with us was Meredith Dixon.
Gotcha.
She was an EIS officer at that time, and she helped us also with the AP.
Are there any other talks that you remember especially giving?
Yes, then I give also a talk with someone from Pasteur Institute in Lyon about Ebola to the French community. Then another one that I gave to, it was a small one, to the personnel of the British embassy. Also, I start to be in the circuit and going and doing a talk like that. The one, I gave one, but that was in the second rotation. I gave a big one that was, two big ones that were interesting. One was at the mosque, at the big mosque. It was just before the Ramadan, so the Grand Imam had the Imam from all the country that were there. So I present something on Ebola and talk to them on Ebola with that. And there was also an interesting one at the university for physician and healthcare worker, where there were several hundred people, and asking a lot of questions. Even some, I remember someone that certainly was eating monkey meat, but didn't want to say it, but he was asking questions of how to prepare them, how you do to be safe. But I'm sure because he was eating some, but that was a lot of questions at that time. And I also did, and that was during the second tour, and I started that to give a talk for the responder, for the people from WHO, because also I realized that a lot of people were experts, supposedly, but didn't know anything about it and have their own ideas. So I started to do an Ebola 101 for the responder, and after that I did it in Mali, I did it in Uganda, I did it in different places.
What were some common misconceptions?
What the reservoir, how you get infected, the duration of incubation, how you make a diagnostic. It's really what are the main sign and symptom. Not everybody had the same idea, so then they end up being not very confident in the response or answer to question that they had, and then it start to drift in different direction. I don't think that was good, because then people were hearing different response to the same question, and that didn't make them very confident in what we were saying. So the responder for Ebola at that time of WHO were okay. There was not yet involvement of WHO Afro during the first rotation. After that, WHO Afro came, and that didn't work very well. But was another point.
During your second deployment, that's when WHO AFRO.
Yeah, so they decide. So the second deployment was in June, July 2014. So that where the really Ebola explode more or less in the three countries. So there was this sentiment of emergency. By that time, EOC was activated. WHO had declared international concern for Ebola, so there was more people, but WHO AFRO decide, because it's in Africa, that they will take the lead, so they decide to create a hub in Conakry. And they don't have a lot of people that knows really how to respond. But they arrive and they decide to push everybody to reorganize completely the WHO office and to put people in charge, and then they push CDC on the side at that time.
This was in June during your second
June,
deployment?
yeah.
And when you say WHO AFRO, is that the WHO representing the entire region or continent?
So there is different, WHO is organized as WHO Geneva, that's the main headquarters, and then there is 5 regions in the world, and for all Central and West Africa, it's WHO AFRO in charge. There is a director. They're based in Brazzaville, in Congo-Brazzaville, and they take me in charge. Like for the Americas is PAO, Pan American Health Organization. So there has always been some tension between WHO Geneva and WHO AFRO. Everybody putting the blame on the other. Mostly Geneva saying AFRO don't have a lot of competent people, which is true. But also Geneva wanting to keep the control, because saying that you respond to an Ebola outbreak is good for the funding, is good for public relations. So they prefer to have that in Geneva than leaving other people doing it. So there always been that tension. And then you have, at the country level, you have a director, a representative of WHO in every country. And this one is usually nominated by WHO AFRO. And it's true that you have, at that level, very variable people. You have very competent people that are well aware of what's going on and good in politics with the Ministry of Health and everything. And you have some people that are there because they genetically related to someone in a ministry, other ministry, and they're being bombarded as country director, and they're not very good. So the one in Guinea had a hard time to start, that he never had been involved before in an Ebola outbreak. So he had a hard time. But I thought, in my first trip, I thought he was not very good. But when I came for the second trip, I thought that he had improved a lot and really start to understand how to do it and being more organized, and he was much better. But then he was pushed aside by all the team that came from Brazzaville.
What do you have a sense of why they decided to reorganize everything and kind of take control?
I think it's same thing that CDC activate EOC is to be better in control of the things and to have some mechanism where you bring whatever you need, and also for political reason, like everybody else, to show that they were doing something, because everybody started to accuse them of not doing anything.
Right. And you mentioned that in this kind of reorganization process that CDC got a bit sidelined. How did that kind of manifest?
When AFRO arrived, they decided they were in charge and tried to push us and say, well, we have this new person going to be doing that and doing this and doing that, and starting already to say, well, the APinfo VHF doesn't work very well, so we're going to start a new database, we're going to start a new system, and brought some people that knew how to do a database, but didn't have anything ready, so it had to go through the same process. So I complained and say, well, we should not be there, and I went to the country director of WHO, and I complained, and he said, well, welcome to the club, everybody is the same, I'm pushed also on the side. So I went to tell them and say that CDC was there from the beginning, we like to work with everybody, but we don't like to be put on the side, and they say, well, they said they didn't care. So I say, well, so now I'll respond the way I need to respond, and say, well, do whatever you want. So I talked to the US ambassador, and I say, well, I need to talk to the president about that. And on that day, there was a lot of traffic. Traffic is always bad in Conakry. So I arrived, and the ambassador was not there, so I was just one-on-one with the president. And so I explained what's going on and say, well, I don't want CDC to be sidetracked and putting on in French we say the strapontin. When you used to go to the movie theater, you have sit, and at the end you have folding seat to get an extra things on each side. So I say, I don't want to be on that folding thing, I want to be on the table. I say, well, that's perfect, and I will tell that. And that night, Dr. Sambo, who was the director at that time of WHO Afro, arrived at the airport, and I think the president went to greet him at the airport and told him straight, well, what's going on with CDC? I want CDC on the table, and he blasted him a little bit about that. So the next day when I arrived to WHO, everybody was saying, what happened? What did you do? We got blasted. I say, well, you told me I can do whatever I want. I did it. Welcome. And then by that time, it was CDC at every sentence. CDC will help us to do that. We were going to work together. It was back again, a big, happy family.
Was the VHF database then continued to
They continued to work with it, and it still had problems. So we make some improvements, so several people can work together on the same database, and so they were things. It was never completely perfect, but it was good enough. And then the problem was the size of the outbreak, where we used to have smaller outbreaks, so each case report from every patient had 2 pages, and people were not filling the field. So they say, well, the system doesn't work. It doesn't work if you don't put data in, that's obvious. But if you put data in, so after that they reduced the case report form, and it works. But in Guinea, they use it during the complete outbreak. Mm-hmm. But then that was the problem with the APinfo here, that didn't have enough people to follow and improve at the same time that thousands and thousands of data was coming in. Making the change was quite difficult.
I've heard that one of the difficulties is that it generated a lot of paperwork, and that sometimes that could get really confusing.
Yeah, but the main problem I see with it, which is not politically correct, is that you can run an outbreak with a very small case report form, half a page. But then if someone from EOC want to run a model or present something with comparing the duration of incubation and the phase of the moon and the age of the grandfather and the age of the doctor, make a nice model with that, it doesn't work because you don't have the data. So there is this conflict between what you need for responding and what you need for internal use and politics, and that doesn't work together very well. So that's not resolved, and there is a lot of question that the problem is there is no other system. So people say, oh, you can use Excel spreadsheet. Well, Excel spreadsheet is the same thing. Only one person can enter at a time, and then it's very easy to screw up the complete spreadsheet by someone sorting but not putting back on and saving and replacing. So there is no real problem, especially when you have so many cases. So we run previous outbreak with spreadsheet. And in fact, that having this 4 outbreak in 2012 with spreadsheet, that pushed us to switch to VHF because we thought it will be better. Well, it was not completely ready for the outbreak. There is some caveat, but I think it's still the best things. But people have to fill the form. If you don't fill the form, you cannot make graph with the data. You have no data. So that's still there, and it's still being used in some of the country for that. And we're going to try to make improvement as soon as we catch up with all the backlog, improvement for the next outbreak.
Right. I had a couple questions on the tip of my tongue. Let me try and retrieve them for a second. Sorry. Okay, I remember. What I was going to ask, I've heard, speaking with Martin Meltzer, the modeler here at CDC, about people, when a response happens, there's a need for information and a push to share information with the public. And one thing he described is, often getting the question, how many people are going to die? Is that kind of pressure something that you saw with?
Not in the field. You have this
field?
Pressure here, or in Washington, or in HHS, or maybe in the US with the press coming up. But you don't have, in the field, you don't have that kind. Yeah, say, how are you going to die? But nobody knows how many people are going to die. My view of the model, which Martin would not like anyway, but I told him also that if the modeler was so good, they will all be millionaire or billionaire because they will play in the horse race and they will win all the time. And that's not the case. So model is valid for a model. I personally don't believe the model that he put in place. Because I think going to 1.4 million case is something that will never happen. It will be riot and stop before that. So Dr. Frieden will say, well, but the model say that if you intervene early, you're going to go down. But in my view, you start on false assumption, which have a value, because that's how CDC got the money. That's how everybody got involved, because you cry wolf. But I don't think it's based on real things. It's just based on what if I got the 6 number and I got the $330 million of the big game that is on the board. Yeah. Happen maybe one time, but how many million times it will never happen. So it's a nice exercise. Now, if you want to go from that to real things, it's a little bit different.
I hear that. One thing that you've said, if people are not putting the data in, that you don't get anything. Mm-hmm. Were there issues with data collection early on?
There's always issue with data collection, plus issue with data management and correction. So if you record on the paper or if you record on the computer, you can make mistake. So there was, on VHF, there was some routine that allow you not to enter data, so the date of death cannot be before the date of onset or thing like that. But there was not all the control. But there is some data that still need to be verified for validity of the data. And the main issue could be the way the US record months and day compared to the real world, where it's day, month, and year. So when you arrive on the 4th of March, and the 5th of March, it could be the 4th of June instead of the 6th of March or of April, and things like that. So there is mistake like that can be done. And there is also some of the data missing where, for example, the outcome of the patient, did the patient died or survived? And if he survived, when did he was discharged from the hospital? But usually the form is collected at the beginning, go back, and nobody go back with that form to the treatment center and say, well, this guy, what happened to him? So if you don't do that, you end up with a lot of people for which you don't know what the outcome is. Or you don't know how long they stay in the hospital because you don't have this data. So in Guinea, during the first trip and during my second trip, I had people going every day to the treatment center in Conakry to collect this data and also to exchange data. The people in the treatment center, they're doing that all day long. They have really very little contact with the outside. So it's good to share what's going on outside and they share what's going on inside, and then you have a better connection with the team. So in order to do that, but you have to be on the job and not saying, okay, it's collected, I don't have to worry about it.
Right, that makes sense. I heard a rumor that at some point there were people who didn't want to be at that computer late at night plugging in data, and that you yourself, Dr. Rollin, would stay up quite late inputting data into VHF during this outbreak. Is that right?
Well, that's right. So we had, when I was there, I didn't have any people not wanting to do that because I'm doing that also, and I don't have a problem, and I can have short night. I don't have problem with that. So I'm quite sure that happened, but not when I was there. I do that, but I enter a lot of data. I know how the system works, and I did a lot of work with VHF at the beginning, entering data, doing some of the first C-trep that were produced at that time were with VHF and doing that. So I did it a lot. I spent a lot of night doing it.
Yeah. Okay.
And other people, maybe they didn't want to do it after the fact, but not when I was there.
No, I can see how that would make sense because you know the system, and so you can probably do it much faster than somebody.
Yeah, I can do faster, but also I think the team lead, when you're the team lead, you're supposed to lead. So you're supposed to show how things work, you're supposed to be there and being there. So I always did that in my life, so I keep doing it. And I like to do it. Now, if people don't want to enter at night, in my view, they can take the plane back home and stay home.
Yeah. I'm going to switch tracks just a little bit. When we were talking about Bundabujo, you mentioned that the CDC relationship with MSF got a little strained. Is that something that you had to work on repairing during this epidemic, or?
No, we did that, and during Bundabujo, it was mostly the fact of one or two person from CDC and one or two person from MSF. At the same time, with the same one or two person of MSF, I had no problem and communication, frequent communication, and not that. But CDC got this black eyes by having this bad relation, and MSF is not the easiest group to work with because they're strong, they know what they're doing, and they really don't care about the other. And they also don't like government in general, and US government maybe in particular. And to help them, like I say, we just bombed the hospital, so that makes the relation better. So they don't like government. So they like to work on the way, but they're very nice to work with if you don't try to direct them. If you
Okay.
work with, that's fine.
Do you have any other memories that you'd like to share about your time, your first two deployments in Guinea? In what is it?
No, obviously the second was more difficult than the first one, because the first one, we arrived, we put in place a system, we had the impression that it works. So when I left, and it was Jim Zingesser that was the team lead at that time, and Mike Kinzer, I think maybe. Yeah, Mike Kinzer also was there. It seemed that he was nearly finished, so he finished nicely. It was not finished, but I had the impression that he finished nicely. But then he restarts, so, and the second time it was more difficult, and then we start to have an idea of the reticence in the Guinea Forestière, why it was so difficult, and then we had WHO, and then we start to have, I think the EOC was starting to be there. I don't remember exactly when the EOC was activated the first time.
In Atlanta or
Yeah,
in Guinea?
in Atlanta.
In Atlanta, it was, I think, not level 1, but activated in July, early July, like July 9th or something like that,
Yeah.
maybe, and then level 1 on August 6th,
Yeah.
something like that.
So there are obviously more questions from the outside, so it's always nice if you can let you work your job there and not having that many conference call and talk with to fulfill the politic above. I understand it's necessary, but it's taking a lot of time. Now I think the second time, I have to look at my data, and I will send you this data. But so I got a phone call from Guinea telling me, and that was certainly through the ambassador, that the president want to talk to me, and he want to have some information. So I got him. I got his secretary first, and then it was counsel, and the next day I got the president asking me what he should do, and so I try to explain the different steps that we have to do for responding to an outbreak, and he got lost, so he say, well, put that on a paper. So I work overnight, and the next morning I send him a document, and that was very well. So he followed more or less the thing that we say, and it was very good for Dr. Sakoba there, because Sakoba started to be attacked by other members of the government, saying that he was not doing the right things, and what he was promoting, and I didn't talk to him at that time, was exactly what I was saying in the document. So that gave him a boost, and he always very nice with me since that, because I saved him by saying the same thing that he was saying.
Can you describe more about your relationship with Dr. Sakoba and any moments you might remember?
Sakoba is very nice. I don't know how he can be still alive after all this outbreak, because he's been on the deck since the beginning of the outbreak. He has the way he was director of the surveillance before, and so he had contact with all the prefecture that call him, and there is no real surveillance organized except if someone has something, he has the phone number of Dr. Sakoba day or night and call him all the time. So he had a network of people calling him, but he's not calling someone else, calling him all the time. So he always been there and always having this this call and this things from everywhere. In addition, so he had the outbreak that is starting to explode in the country. In addition, he had the president that called him day or night, and you cannot put the president on hold. You have to tell him exactly what you think and what you want to do at that time. So it just a lot of pressure, and his health is not that good, but he's still there and he's still ongoing. So I really admire him. And the other thing with him on stage is fantastic. He can say joke, he can do he knows everybody, he knows the trick of everybody, he knows the bad side and the good side of everybody. So he is with journalists when he's in a good shape is really fantastic. And we had every Saturday, we had a conference, a press conference that was organized at the Maison de la Presse. And on that press conference, there's always Dr. Sakoba, the Minister of Health, the Minister of Communication, then the MSF representative, and a WHO representative, and a CDC representative. So we all online, and then we have journalists asking questions that are sometimes tricky, sometimes clearly completely wrong, but you have to do that. And he's fantastic at shutting down some stupid question and having all the rest of the room is really very, very, very good, and is very strong. So I hope that we're not going to let him fall after when everything is over, that we still be around and support him.
Absolutely. And in between a couple of your times in Guinea, you're in Ghana for some meetings. Can you describe what was going on there?
So there is a group of public health organization that are under the African Union political group. They have a section that is health. So there is a group like that. And they organize meeting with mostly the Ministry of Health and the Secretary of Health of every African country. And they try to put something in place, but they badly organized, but they want to be aware. So I was invited to that meeting, and also same thing, the first session, I realized that all the ministers there, nobody had a clue about Ebola, nobody knows anything, and then it was really variable. So again, I propose to say, well, I can make a presentation in French or in English on Ebola 101, and we can restart, and it works well also, and they were very happy to have that. So I went to that meeting. And Ghana I've always been interested because they do a lot of glass beads, and I'm collecting glass beads. So I thought it was a good way to get some glass beads. And I came back with a lot of them, but that's fine. But I didn't have time to go to the place where they make them. But next time.
Yeah, I'm not surprised to learn that after we talked last time about your collection.
So it just it was nice. So. And I did also a presentation when I went to Ghana with at the U.S. Embassy for few local. There was very few people because they thought they were far away and they were not worried about it, and start to be the vacation time, so a lot of people were back home. But I did a presentation also at the embassy there.
And shortly thereafter, let's see, it looks like you spend most of your month of September in Liberia.
In Liberia, yeah.
So can you take me through that time?
So Liberia started to be bad at that time during the summer, with the number of cases going up there. And I was in Liberia with Frank Mahoney, that were there, that I didn't know before, and I really like to be with him. He's really down to earth and very, very good. And then when I think both of us arrived, we saw that the relation between CDC and WHO were not at the best. WHO, again, the local director was a guy that I knew from a long time that was a little bit too old to respond to that type of outbreak, so he was moved away, and there was someone that came, Peter Graft, that was coming from more the emergency side of WHO, not really the infectious disease. And Peter Graff is very nice, and we had a very good contact between Frank Mahoney and that. So we tried to organize that and see what could be done. And then we had several people from CDC deployed in different area, try to reorganize that. And when I arrived, the first person that was at Elwa 2 at that time, MSF, was the same guy that was at Conakry. So directly I had a very good connection with MSF, and he works fine. The lab was run at that time by two people, one from CDC, but mostly NIH, and it was Heinz Feldman, that is the director of the NIH lab in Montana, that I know from, he came twice here for a long period of time here at CDC, and I knew him for a long, long time, so I had a good, very good connection with him. The main things was to try to organize or participate a little bit to the organization of the burial team and the burning at that time of bodies at close to the airport, and discuss with them. But most of the things was the discussion with WHO and try to organize regular meeting and not having WHO on one side and CDC on the other side.
Right.
And I think it works well at the end. Everybody was more working together. That was fine. And that was the time also when the U.S. Army arrived there. So there was the first deployer was a group where you have physician and logistician, and it was headed by two-star General Williams that was there, and they were at the embassy there. So we work with, I worked with them to explain what to do, and I had, again, I made another presentation for them, and a presentation for the U.S. Embassy there, and then had a special presentation, just the general, the chief medical, military guy, and just to discuss what should be done and how it could be done and how they can help and everything. And I remember making a joke about the general, saying that he was a chicken because he was afraid to carry specimen, Ebola specimen is in helicopter. So I said, well, you're going to go to war and a box scare you. And we had a lot of problems. They didn't want to carry specimens. And so I would say, well, you're just a chicken, a big guy like you. But he was very nice.
How did he react to the joke?
Oh, he liked it. Yeah, I like it. He was a nice guy.
That's good.
He's still, I'm sure he's still a nice guy. But but that was good. One thing I deplore at Liberia is knowing the relation that we had in Guinea directly between CDC and the Minister of Health and the President. We didn't have that in Liberia. There was some connection with a minister time to time, but he was well planified, organized. He was not at will like we used to have, and there was, at least when I was there was no meeting with the president. Everything went through the ambassador. So it was Ambassador Malak at that time. She's now in Uganda. That was keeping a little bit things a bit closer. I think we could have certainly proposed other things. I don't know if that would have helped, but directly if we had access, but we didn't.
Gotcha. Can we talk more in more detail about your suggestions for the burial teams?
Yeah, so when it started to have this burning the bodies, that was a mess, unaccepted for the population, unacceptable for the population. So I suggest her and I send her an email saying that maybe what we should do, and there is also a problem is in Monrovia, where most of the people live, is very low, so you have water coming up. So even in place where they buried people, it's difficult to bury people because you have the water just there. So I say, well, you should do like we have in Normandy, or the US create in Normandy, this big cemetery where you put the cross or stela, if it's not a cross, in line. You can see that from everywhere, and that will serve as a memorial for the population, and then during the outbreak, it will help to take care of all these bodies, and after they can go to that place, and that's where whoever was hospitalized from the family, but didn't get any traction.
No.
I don't know if she offered that to the president and the president said no. She said no, I don't know. I never heard anything about that. After that, I think it was really, really bad.
When you say her, you do mean Ambassador Malik?
Yeah.
Yep.
So beside that, I was not really, so that started to be, again, politically incorrect. Not very impressed by the team deployed there at that time, either the young or the team lead. I think the team lead were not really connecting with other group. It was CDC for CDC. And then the younger people didn't seem very interested, except what can I write to? I need to do an MMWR because it's this, I need to do this, more than responding. At least the first team when I arrived, there was a lot of change when I was there, so the new team after that was much better, but the first team was not really really good in responding, and that's my view.
Well,
that's my story, and I stick it to it.
No, of course, and we will of course edit
yeah,
some
but
of this before
I'm
it
not,
comes out. But I want to ask.
I'm not shy to do it,
right.
to say it, because I think it didn't work well.
And given that, I think that's really useful to have some of this down so that CDC can learn from its history.
Yeah.
Would you mind who was the team lead at that time?
The team lead was Jordan Tapero and Atalia Christie.
Okay.
And I knew Jordan because he was a country director in Uganda when we had the outbreak. But he was, and maybe the credit I can say, there was a strong pressure from Atlanta at that time to be more responsive or to do whatever. But I thought both of them had very little contact with the rest. It was not a coordinated response. It was WHO were doing the things, CDC was doing the things, MSF were doing the things, but there was no connection. And we tried to restart. I told them that in Guinea, one thing we did, usually we had this Saturday press conference, but after that we had a meeting where just 4 people, there was WHO country office, Dr. Sakoba, the head of MSF, and the head of CDC at that time, just to discuss between us some big orientation, big things, what the other were planning to do, just to organize. And with Frank, we start to do that with WHO, try to have a non-official side meeting where we try to understand who was doing what at that time. And that was not something done before. And I don't know if that happened after that, because at one time I was the plan for me was to go back to Liberia, but to be the safety person for the MMU, for the Commission Corp lab, but 2 or 3 days before I was hijacked.
Wait, what? What did
to
you
go
have
to
to
Mali.
do? Oh, to go to Mali. Gotcha. Did you ever meet with President Johnson Sirleaf?
No.
No?
No, no.
Didn't
That was not
have the
something-
access.
No, we didn't have the access. The ambassador has a connection with that, but not
Gotcha.
not me. I think Frank stayed much longer there, so I think he had contact 1 or 2 times, but very rarely. When in Guinea, at least I had, for every tour, I had 2 or 3 times with the president.
Mm. I know you also, didn't you also make some suggestions regarding burial in Guinea? Or was it only in Liberia?
No, it was only in Liberia. Guinea, we never had the same problem of number that
right.
Monrovia had. So that there was some suggestion for, I made some suggestion with the way the body wash was done, try to get more. So I had several contacts in Guinea with the Imam, the Grand Imam of Conakry, but also with the Mufti. The Mufti, I think, is the person that decide to see if it's like the Supreme Court, if the Constitution, if the Quran or the interpretation of the Quran is correct. So we had the problem during the second trip that the Ramadan was coming in. So during Ramadan, Muslim cannot drink or eat during the day. It's just at night, but not during the day. And there was a lot of Muslim healthcare workers at the treatment center, and they cannot survive without drinking. So I want to have a blessing from the Imam saying, okay, because of the role, because I know that in Islam, if you're a traveler, pregnant woman, if you're sick, you can have dispensation. And at that time, they say, okay, you're not doing it, but either you're paying a tax, a penalty, or whatever, or you stay an extra week during the Ramadan when it's over, just to catch up whatever the number of days that you have done. So I knew there was that. And I want to have that in writing so the worker from MSF can do it and not being blamed by others saying, oh, you're a bad Muslim, you're not respecting that. And so I didn't succeed for that Ramadan to get the right document in writing, but I know that for the following one, they had a letter saying, I'm allowed to do that, signed by that. So that allowed me to discuss with the Muslim administration of Conakry to try to change that, and then asking them if you wash the body with bleach, is that okay or not okay, and it's okay, so they can do that. And so trying to improve or reduce the risk for people washing the body, because we can say you should not, but they will do it anyway, so you have to have another solution.
Do you have some sense of whether those conversations impacted the response?
It impacted a little bit, maybe in the way people were thinking, because the people, either the Grand Imam or other people, were from the hierarchy of the Muslim hierarchy at the mosque, were passing message on the Friday prayer and saying, okay, you can do that or you cannot do that, or it's bad. So that has certainly an impact on the response. And I think, like I certainly said last time, my theory in Guinea that they had less case and less transmission is because of the Muslim and the way they handle body and the way they respond. And I think that has an impact.
Gotcha. Thank you. We should also move to the domestic sphere at some point here. So after Liberia, you get called to Texas, right?
Then Texas happened. So when I left Liberia, I discovered that after a journalist told me, I was in the same plane that Mr. Duncan, the guy that went to Texas and developed his disease there. I was not seated by him, as far as I know. We were tested 3 times for the temperature before taking off, so he was not sick at that time.
You took the same flight at the same time as Mr. Duncan?
Yeah, in the same plane.
Wow.
But it was just, I didn't recall it, but I had an interview with a Canadian journalist in the afternoon. I was leaving at night and said, well, I'm leaving tonight. And then that journalist called me after the Dallas story and said, well, you left on that day? I said, yes. Well, so you left with Mr. Duncan? I said, well, I don't know it, but if you say so. So I was in the same flight.
And you were probably on your way back to Atlanta, and he was on his way to...
He's on the way to Texas. So I was, I think, in the same flight to... I think it was Amsterdam. It's KLM, yeah. To Amsterdam, and then I went to Atlanta, and he went to Dallas. So.
Gotcha. Wow. So how do you get involved in Dallas?
So Dallas, the first time I was involved was at EOC. There was that rumor, oh, there's something going on in Dallas, there is someone sick, and then we got the specimen here, we confirmed was positive. So there was a conference call at EOC, and there was a lot of people from hospital infection that were around, and they say, well, we have a conference call, we're going to go in the small room. So I went with them in the small room, I followed them. I remember there was no seat, not enough seats, so I sit on the floor against the wall like I do usually. And they were talking, and at one time I want to ask a question, and the one at the phone looked at me and said, later on, didn't say anything, but make me understand that I have to leave the big boy talking, and I will be, I can ask a question at the end. Okay, shut up. And then the same person at the end of so they were talking, and there was a bunch of experts. None of them have ever seen an Ebola case or being deployed, but they knew everything. They're from CDC. So well, I let talking, and at the end, the person that told me to stay on my side look at me and say, who are you? So I say, Pierre. Oh, Pierre Rollin from VSP. Do you have any question? Do you have any question? No, I don't have any question. I think you answer everything. It's perfect. And they went, and the first team went there. And then, whenever 10 days later, there was the nurse that was infected. Then I was told, you're going straight. So I went with Mary Troy. She was an ES at that time. She was in Guinea at one time. It was else communication was Dave Daigle. And then we meet some other people from NIH there. So I arrived at the hospital, find the hospital quite desertic. It's a nice hospital, there was very few people there. And at that time, the index case had died, and the nurse had been moved from the emergency place to another place. In the emergency, there was still some suspected case. Or maybe the first night. So I arrived, let's say, 2 o'clock in the afternoon, and I went to the emergency, and I started to talk to the people, and I think maybe one nurse was still there before being moved to the other ICU that they create. And I start to talk to the nurse and say, well, do you have any question? And they had plenty of questions, and I stay around. And I think I went to bed, it was 3 o'clock in the morning. I stay all the afternoon, all the night, more or less with them, and asking questions and helping them to dress and talking to them. And then they say, well, there's other people that have questions. So I went to the rest of the emergency group, and I talk about Ebola and how you get infected and all the stories. So it went well. And then, so the next day, there was the rest of the CDC team that were mostly involved in contact tracing for all the nurses that were there. And so we say, well, we have to be sure that all the nurses are protected, because I realized when I stayed the first night that they didn't really know what to do, and they were not really trained or supervised or anything. So we had to do better, and I think maybe Mary Troy arrived the next day or that, and we designed how they can dress, and then we went to the place where the first nurse was, and we decided that they were not really supervised to do anything properly. They were trying their best, but they have nothing. So I went inside the ward address and went inside the ward, see what was done, what could be done. And then we say, well, we're going to change everything. We changed the way, because they were entering and getting out from the same place. We're going to change this, we're going to change that, and we're going to do that. And I start to stay. So there was always someone inside from CDC. So it was myself, Mary Troy, and then other people from NIH that were there, but I spent quite a lot of time. I beat my record of not getting out, staying dressed without even going to the bathroom for 20 hours and staying there. And then, so we changed that. So I had a very good connection, and we had, all the group, a very good connection with all the nurses there that were there. Because they had a lot of questions. I had nobody to answer the question. So I be there asking questions, and when we were staying inside, we were helping them to clean the floor, to disinfect, what to do if you do this, what you do that. And then when someone was getting out, so we put in a script and say, well, you wash your gloves. So there was no possibility of diverging and doing something wrong. So you wash your glove, then you remove your apron, then you wash your glove, then you do this, then you wash your glove, and then so they were following a strict script. And before they were going in, there was also one of us on the outside doing the same thing for dressing people. So be sure that they down and doff properly for that. And then we had good connection with the safety group at the hospital, and we found for the trash that they were stocking the trash in one of the room, and it was not, all the waste, it was not well done and had difficulties. So we discussed with the safety group from the hospital, and we create an extra room with plastic cover with zipper and everything to put all the trash container, and then try to reorganize that. And really we had, so I spent most of the first week. So then the second nurse arrived, there was a 2 nurse, and we stayed there until the 2 nurses were medevac. And I think that was very hard, because the nurse at the beginning feel that they were not supported, not advised properly. And then they were accused by everybody to not doing the job, and that's why they were infected. And then when the 2 sick nurses start to be better, the hospital pulled the plug and then medevac the 2 patients. So the 2 patients was already on the right convalescence track, and they were moved away. So the nurse had the feeling that they were again blasted, say, well, you cannot do your job, we're going to remove the two. And when they get well and they were discharged from Emory or Bethesda, Emory and Bethesda got the credit, not the people not there. And I say as a joke that when the one that went to NIH, Dr. Fauci just lay his hand on her and she survived. Well, she was already getting better and she will have survived, but it's because he was there and the impact of his hand do the job. So it was very bad for the nurse there. But we had a fantastic relation with her at the end. So everybody was watching somebody getting out. So I was the last one to come out when everything was clean and before the final disinfection. So everybody came out and I watched the last one and do the script for the last one, and I was the last one to get out with nobody watching me, but I think I know how to do it, so I came out that way. And then there was so we wear the PAPR, positive pressure mask, so it's a shield with a mask around, and at the end there was two nurses that had I heart Pierre on the thing, and it was, and we had fun because when you have nothing to do during the night and you have your two patients that are sleeping because they're getting better. So I think the only thing I need to do, and I don't know how to do yet, I need to learn how to do the moonwalk just to make people laugh in the intensive care with the patient. I still need to learn that for the next outbreak. It will work fine. But we had good connection. We didn't have such a good connection with the physician side of the hospital. First of all, because I thought they were never there. They didn't show up. They were doing by phone. And it was not very nice. And then, so when the two patients were out, we disinfect everything, and we did the training classes for the healthcare workers. So we did 3 or 4 sessions, and we trained 100 and whatever things how to put properly the PPE, how to remove the PPE, and again my general 101 Ebola and that, and it works well. I had some bad time with CDC home at that time because CDC changed the recommendation and the guideline for downing and doffing. So the same group of hospital infection that went to Dallas and didn't do anything for the hospital infection, in my view, were changing the recommendation, but never consult with us. And we were doing the training after the fact on a script that, and they were, suddenly we discover and say, well, here's the final draft of the guideline that's going to be published tomorrow. Do you want to have a look on it? And say, well, damn it. We are involved here. We should have known that before, because then you're going to have a new guideline that is different than what we say for training the people, and everybody going to look stupid, and CDC going to look stupid. I don't care if I'm looking stupid, but it will be bad. Finally, the version was not that different to what we say. There was 1 or 2 small things that was okay, but there was no real coordination. And the things with Dallas keep going. That's that for the history. Maybe that's going to be a file and the director only could open it. But so when the things was, there was all this lawsuit against the healthcare, against the hospital, the doctor, and CDC was afraid to be involved because we had a team early and they had to send a second team. That doesn't look good. So when we try to publish the data, so Texas published something, and then the group from Hospital Infection want to publish something, and for the small story is Dallas told them, okay, if you publish that, we're going to publish another article saying that you're wrong. So they pull out the article. And then we want to publish what we did, just the response, not the political part, what we train, how we train, and what we did. And it was put on hold by CDC, and we had argument with the hospital infection group that they didn't want us to publish. And finally, only one paper was published. It was our paper. So that was good. And Dallas was okay with that. We had author from the hospital. But the hospital in Dallas was, the medical side was not very good. They were not present. And that was night and day when I arrived in Washington. So when I came back from Dallas, I sent a nasty email with some detail.
To who?
I didn't get any answer to that nasty email.
To who?
Because of FOIA, I think.
Oh.
So, but I thought, okay, they're not going to invite me again for going anywhere.
Oh, you sent the email to Dallas Presbyterian?
No, to here.
Out to here.
And then, 2 days later, I arrived to work here, and I got a phone call in the morning, you leaving at noon, you're going to New York. There is a case in New York. And then it was not noon, so I say, noon, I need to get at least a suitcase with a few things, so I rush home. I live in Gwinnett, so it took me some time to get there, make a suitcase, let my wife know she works here, but okay, I'm leaving, I'm going there. Then it was delay, and finally they say, you're going to take, the White House is sending a plane, a small plane, whatever, Jetstream or whatever they call them. I say, that's great. Which terminal is that? Because I don't know where you get it. And it turned out not to be a terminal, but a place north of, it's the same airport, but there is some building north of the airport where you have these fancy people traveling. So I travel in the fancy plane with Rima Kabas and David Daigle again. I like that kind of plane. You don't have to worry, no TSA, no line, nothing. You're coming, you go up and you go down. That was it's very nice. I can see why people get used to it, if someone want to pay. And then I went to New York, and that was heaven.
How is it so dramatically different?
So clinicians were there 24/7. The complete hospital was behind the team there. So there was, the head physician is Laura Evans, an intensivist or emergency physician, I don't know what she is, but she's very nice, very open, spend 20 hours a day there during all the hospitalization. When she was not there, there was another physician just there. All the nurse and the people were very dedicated. All the administrative were behind and helping. I'm sure everybody get 2 extra pounds of fat during that hospitalization because we got cookies, sandwich coming from every ward in the hospital in Bellevue to support our morale. There was, again, people from the administration always there. Do you need anything? Can we help for this? Can we help for that? It was really, really fantastic. And I didn't, so I knew the Spencer, the patient. I knew him from before. I met him once before. I knew that he was inside and he knew that I was outside, but I didn't try to go inside the ward, so I didn't dress. I helped people for tweak a little bit the way they were putting the PPE and what they could do or not do, but they were doing that perfectly.
How did you know Craig Spencer?
Because he was in Guinea at the beginning of the outbreak, so
Right,
I
with
knew.
MSF.
Yeah, he was MSF there. So, and so I was there, and I stay on the side, and I just say, well, if you need any advice, I'm here. I can do that, and I can be here and help advise. So I spend a lot of hours there, day or night, because I always like the night shift in the hospital better than the day shift. The night shift is people are completely different. They work more quietly. There is less people in the hospital. There is no administration around usually, but they're always forgotten. So when you do training during the day, so you're missing always the people at night. So, and even when I was a physician and work in the hospital, I always like nights because I like the people at night. So in Dallas, I did the same, and here I did the same. Being at night, to see the people at night, that they feel sometimes a little bit aside. So I stay also day and night, spending the hotel was not that far. So doing that, and it went very well. I had few arguments with hospital infection again. It was funny because the one guy that was there started to wanting to direct me and say, well, you have to do this, do that. And then I remember one time I went from the New York Department of Health, and I went to the hospital because they asked me to do something, and he heard about it, and he called me and said, well, what are you doing? I said, well, I'm going to the hospital. I didn't tell you to do that. I said, well, you haven't done your lesson yet. I'm not listening anybody. I'm doing whatever I want when I want. You should have asked for that. So I went to complain to Rima that knew me and didn't say anything. And after that, this damn Rima and Dave Daigle was just laughing and say, well, we were wondering how long you're going to be working together.
This was a CDC person or a hospital administrator?
CDC person. But he works fine, and I think this guy is insecure and full of himself, but I didn't care. He was complaining that the hospital are tired of seeing Pierre all the time there. I said, well, it's funny, just invite me to do a presentation. So I started to do a presentation again for the clinician of that, and then the lab wanted a presentation, so I did I ended up doing 4 presentations in Bellevue for different group that want to hear about it, and then they invite me later on, a few months later, to go do a grand round there. So I think they like me. But it was really nice. And during that one afternoon, I think I was walking back to the hotel, and I got a phone call from Dr. Frieden's office and say, well, we have a problem in New Jersey, and with the nurse there that's been hospitalized and isolated. You may be going to ask to go there, okay? And then I walk another block, and I got another phone call from Dr. Frieden's office and say, well, you're going there in the next hour. Aye, sir. So I round up Mary Troy, that was there also, and I say, well, let's go to New Jersey. We're going to see Hickox, what's her name?
Casey Hickox?
Yeah.
Mm-hmm.
You're going to see her. And I understand why she was not happy. So we arrived there, and so we visit, and they were very happy. Oh, she's isolated there and there. So we went to see the isolation place. So it's like it was the first floor of a building that was not really occupied. So it's like here, and they put some tent in the middle of that room. And then it was very cold because the healthcare was using hazmat very heavy things. So they were hot inside. So the room was very cold. He had a tent. She had a bathroom that was like a camping bathroom, not very nice. She cannot see anybody, and she started to complain because she was not sick. She had no reason to be there. And I think they made a mistake to let her with an iPad, and she started to connect with some French journalist, and she started the mess. But she was right. So we stay, I don't know. So when we arrived there, it was maybe 8 p.m. We stay until 4 p.m. and then we went back to New York.
I'm still kind of unclear. What were you helping with there?
Try to see I think the office here want to know what's going on and what there. So we went quickly that way to see the clinician, if she was isolated, not isolated, what was the condition, and so we stay until 4 o'clock in the morning, and then we took a taxi back to New York, and I went back to the Bellevue Hospital. But Bellevue had this team really very cohesive, and one of the reasons is they had few years before Sandy that came through New York, and they had to evacuate in the middle of the night Bellevue. All the intensive care units are on the 7th, 6th floor, whatever, high. They had no power anymore. The emergency power crashed. So they had to get all the patients through the stairs with the people that were ventilated, with some people going there. So, and evacuate the complete hospital. That is quite a big hospital. So that create good link between people, and they were all together. But there was funny thing, and for example, Craig at one time wanted exercise, so the hospital provided him with a bicycle to put in his room. So he was isolated, but he was bicycling, and then he's playing music. So one of the chief administrative came and say, well, I play guitar and I also have a banjo. I know that he wants a banjo, so they brought him a banjo, so he was playing. So the room has a camera and an audio system for the support. So we had the Ebola tour banjo that was done. That was really nice. Then I met Craig after that, again, when I went for the grand round and we went dinner together, and then he came for a meeting recently at Emory, and I had him on the phone, and I had Laura Evans. So it's a really good team. Yeah. And I met, during that trip in New York, I had 1 or 2 meetings also with New York Department of Health, and there was an EP there that I knew because he came to Gulu with us, Scott, forgot his last name, okay. That is working there. And then New York Department of Health asked me to go one night to make a talk in the health community that was close to where Craig was living, because he was doing an incubation there, so they want to know a little bit about that. So I went there and answered questions to the neighbor, to the people living around, and it was nice again.
What kind of questions were you getting?
Oh, what the risk is. I went to bring something because at that time his wife was in quarantine in his house. So I brought the neighbor. I brought in food or what. Is there any risk of doing this or doing that or having these people crossing? And but he had very good connection with his neighbor, so there was really no real problem of any kind. But he was in front of Bellevue was a circus with all the TV and radio and.
Right. So, after New York, you go to Mali, is that right?
So after New York, I was supposed to go to Liberia for the MMU. And then Mali started, and again, I was hijacked and sent to Mali. I really enjoy Mali. So the relation, so there was no U.S. ambassador there. There was just a DCM because the ambassador was changing. And there was a little bit micromanaging, a lot, more than a little bit. So I asked, when I went there, I asked Lascaris, Ambassador Lascaris, to send an email to his colleague in Mali and say, oh, I'm going to go to Mali, give them the word that I can help in few things. So went to arrive in Mali. So I was not the team lead, I was an advisor. And the team lead was Jeff Hammond, is the country director in Ethiopia. And the good thing is, he's a very good guy, and he was a Peace Corps in Mali, so he speaks the local language. And he liked Mali, so we did a lot of good things with him. So we, first the response was good. The team of AP from CDC was very good.
Why were you called there in the first place?
Because I was speaking French, and I think Dr. Frieden was concerned that Mali was a new country with new case, and the outbreak is extending, and that. So Mali was start with an imam at the border with Mali and Guinea that was sick, went to Bamako, was hospitalized there, and died there, and then there was 2 or 3 generations after that. So all the team, CDC team, was really great there. And so I arrived the first day, I go see MSF to just say, well, I'm here. If you have any question, if you want to know anything, I can help. And there was people that I didn't know, and they look at me and say, huh? Who's that guy? And they were quite cold. Okay, fine. I just offer help. And I got a phone call in the evening, say, oh, Pierre, you come. We didn't recognize you. No, you have to come back, and we want to see you. And I guess they didn't know me, but they called whatever the boss, and they say, oh, yeah, this one is okay. You can deal with him. So I was, after that, I had a good contact. I did a presentation, and all the same. Always the same thing with them. But the team was really good, so we I always travel. I have a hard drive where I have all my data. I work with this hard drive, so I have data from all the previous outbreak, all the document, all the form, all the things, so I can provide things very quickly to everybody if they need something. So I did also for the response an Ebola 101 also. The part of the lab at that time was done by NIH, based at the University of Bamako, and it was I met again Heinz Feldman, so the connection with the lab was correct, and no problem with that. So we went to the different place in there. I met a cousin of mine that I haven't seen for 40 years that was working in Mali, so that was good on the personal point of view.
Who was that? What were they doing?
Oh, he works as electric company there. He'd been there forever, but it was nice to meet family. Yeah. The art in Mali is fantastic. Bought some beads and some other things there. But the funny part was, it's not Ebola related, but with Jeff is, so he knew people there. And I say, well, you know, there's this photograph in Mali that is very well known called Malik Sidibé. There was another one called Seydou Keita, but he's dead. But Malik Sidibé used to have a studio, and there is exhibition all over the world of him, of black and white picture that he took. At the beginning, he was with, I don't know what kind of equipment, but at the end, he got the Hasselblad prize, and he got a nice Hasselblad, and he's doing that. So I say, yes, I heard about him, but I don't know exactly where it is. So we took a driver and we went there. So we arrived to the studio, and it's just one room. We call it a studio. It's just a small one room. And it's not there. Oh no, he's retired. I'm his son, and it was the son doing the picture. I said, well, we like to do like everybody else, a picture of us in black and white, and that. So the studio, you have like a small stairs, and then you have a background is a fabric typical of Mali, and again the same fabric you can see on picture that the father took in the 60s, 70s, 80s, and they all there. So you go there, and the guide say, okay, you put you like that and like that and like that, and you have picture in black and white. Then they provide you the contact. So it's done with the Hasselblad, so it's 6/6. You have the contact, and then you choose the one you want. And so we say, well, we want this one, this one, and this one. And then you come back a week later, and he had the good thing. And I say, well, your father is still alive? Oh, yes, alive. If you want, we can go and see him. I said, well, definitely we want to see him. So we went to see him in his home, and he was old and had vision problem, but he signed the picture, even if his son did the picture, and he showed us all things that cost not million, but hundreds of thousands of dollars that he has in his house. And we had picture with him, and we talked with him. And he died a few months ago. There was a big article in the New York Times with his death, and so we had that. And then music in Mali is very good, so we went to a studio where they were doing recording, and we got a bunch of things. It was really, really nice. Mali was nice.
Yeah.
And the response went well. There was only a few generations, and it stopped. I was involved in the contact tracing because there was some problem with some family. So they asked me to go and try to solve the problem with this family. So when the first day, they let me in the sun, standing, they were in the shade, and they were complaining about this and this and that. We asked you to do this and that. And okay, I discussed and do that, and came back the second day and asked, then figure out what was wrong, what he didn't like, and mostly was the kids were expelled from school, they cannot go to class, and so okay, I bought a bunch of drawing material and books and school books and give that, and they were happy. So after that, I was in the shade, and with a seat in the shade, and the family was happy, and discussed with that. But I had a lot of good interaction with different family and connection, and then the person sick of Ebola, one of the person get well and he has to be discharged, so I help MSF to make the connection with the family and stay at night when they discharge that person, and give some advice to some of the MSF personnel and train. So Mali was a good success, but it was, again, a good team. So the embassy was micromanaging, so didn't want us to talk to the press. But then after 3 weeks there, they realized that nobody was talking about the U.S. government response. So they say, I say, you told us we can't. So we don't. Oh, yes, you can. So the last week I had a presentation every morning and afternoon to the different thing. We did something with Pascal. I'm really bad with name.
Okay.
Here for training of the Imams, so we had several sessions of Imam training again there. It was a really good response, a good team of CDC in the field, a good connection with the different group with WHO, and then that, and he works very well in Mali.
So as we look over your entire response, Actually, I shouldn't ask that. What I should ask is how does your involvement in the Ebola epidemic continue after Mali?
So after Mali, I went to Guinea twice this year. So I went in the spring, and it was nearly finished. So I went so often in Guinea that I went 2 times with my wife also. She's physician and French, working here, so she helped. So one of the trips she did the connection with MSF, so she was going to MSF every time. And the second trip she was connecting the different laboratory in Guinea. We didn't have any involvement in the laboratory in Guinea, so and we tried to coordinate that, which was quite difficult. But I knew everybody in the lab in Guinea, so she helped to coordinate all of that, so that works well. So I went back in the spring, and she was with me at that time also. And that's why she did the lab part. But at that time, it was really nearly finished. There was still case, no more case in the Guinea Forestier, but there was case in the Guinea, the Basque Coast, at the between Conakry and Sierra Leone, there. And then we had several trips with the ambassador and the helicopter again, and doing some training, because they were Muslim in that area, so we went with the Imam also doing that. Then we had also one time in the fall of 14, but also one time in 15, Dr. Frieden coming. It's difficult, I would say.
Yeah.
When Dr. Frieden travel. It's very organized and timely, so that and it takes more or less everybody is involved in his response there, to be sure that he meet everybody, that his time is limited, so he had to be minuted. But that's quite hard. And then I went more recently in Guinea for the last flare that they got with sexual transmission in March, I think it was, 16.
Okay.
Then the other 2 deployments I had is California, where we had a Nigerian lady that was infected in Nigeria, then recovered, then become pregnant and deliver in California. So everybody was scared of something happening, and nothing happened. But so I went there also with Denise Jamison and then there was the people from California, from the LA Department of Health. And then I went to Texas again, because one of the 2 nurses got pregnant and after the fact and delivered. It was quite weird, and that reinforced me of my view of that hospital in Dallas, because we were invited, but they put us in an office and we stay in the office. I haven't seen the lady nor the child, or even the OBGYN department.
Oh.
When in California, we were in the room with the baby. I collect the sample and the placenta, and I record it and did that. But in Texas, no. That's fine.
Okay. How's the Todd? Do we have more space on the tape still?
We got about 9 minutes on this one.
Got about 9 minutes.
So
okay.
one thing that I did in Guinea, I don't know if I talk about, is working with the cartoonist.
Yeah, please. Let's see.
So when I arrived the first day in Guinea in 31st of March 14, when I changed money at the hotel at the small bank, there was a local newspaper with plenty of cartoon of Ebola. So I bought the newspaper from the guy in the bank, and most of the cartoons were made by a guy named Charlie. And so I asked the guy at the embassy if I can contact him, and then I contact him, and he got starting to do. We did some T-shirt with him, with the help. It was funded by the CDC Foundation, but we did some T-shirt, we did some sticker, and then we asked him to draw some cartoon of the different sign and symptom of Ebola to use in health education. We brought him with MSF. So he did a drawing of the treatment center to pass some message. And I have all these drawings because I bought them with my own money. So I kept the original, and we use it for the rest.
That's really fun.
That was fun.
As you look back on all aspects of your involvement in the Ebola response, is there anything else that we haven't gotten to that you'd like to talk about? Any moments?
No, I think it was a huge outbreak. I was very happy when I was in the field. I was very disappointed when I was here. I spent a month and a half at the EOC. It's hell. The politics is so huge. Oh. I remember after my second tour, I came back and there was this org chart of EOC, and there was plenty of boxes and 4 small boxes at the bottom saying Mali, Guinea, Sierra Leone, Liberia, and I said that there was a mistake, that things was upside down. And I was told that I need some rest. So it's very disappointing for all the political aspect. I think we could have done better with less politics. But I can understand that there was that politics here that was very high. I was interviewed in Guinea by the guy from CNN, Sanjay Gupta. He wants me to say that Ebola will come in the US and wipe out the US, and I say, no, it's not going to happen. And he was very disappointed because I didn't went on that way. But I saw him one time after that at the airport in Atlanta, and I went to talk to him, and I reintroduced myself and say, you remember you told me that? Never happened. Oh, it could happen. No, never happened. How about that? On the personal point of view, I really had the impression that everything I'd done for 20 years went to trash in front of me. So all thing we did in the branch, all the preparation, all that, nothing applied. We had plenty of new people from CDC that reinvent the wheel. Nothing going to be like it was before, so the next response to the outbreak will be done by an EOC-like, not by the branch. So on a really personal point of view, I didn't like it. I didn't like what it went to it and what happened. I'm told it's a new CDC, it's a new normal, but I like the old normal much better. And I don't think it's good. I think it's too much politics, less science. But I'm the old generation, so meteors are coming and dinosaurs are gonna disappear.
Right.
And it's just I'm very grumpy and sad about Ebola and the way it is now.
Is this related to the new Ebola affected countries office?
Partly yes, because I think when they will have no more money to do what they're doing, they're going to jump on anything that Ebola everywhere to justify the activity. So I don't think it's good for the branch in the long term. We used to be able to do everything that I was trained. There is no way I can train anybody else to do the same thing now because the same thing doesn't exist. So I think we're losing at the branch level. We lost the battle. Ebola killed us, but I'm the only one grumpy. Everybody thinks it's perfect. So, and that the new CDC will be much better. Okay. Good luck. But it just, for me, it was really disappointing to have all these new experts that just learn how to spell Ebola without misspelling, explaining what to do and how to do it. Well, new CDC.
New CDC. Any other thoughts before we cut you off? No?
I'm grumpy enough.
Okay. Well, I very much appreciate it's been a pleasure listening to you, Dr. Rollin, and very educational. And thank you for spending the time and energy for this.
You're welcome.